When should you take your child to see a dentist for the first time? And at what age should you start brushing your child's teeth? My name is Dr. Sarah Bodo. I am a dentist practicing in Kenya. I am passionate about educating the public about oral health, since oral health is a mirror to general health and general well-being. Today, we'll discuss about pediatric dental health. That means dental cavities, gum diseases, and when a child should visit a dentist. With me in the discussion today is Dr. Zipporah Rob. She's a dentist passionate about pediatric dentistry. Dr. Zipporah Rob, welcome.
Thank you, Dr.
What is a pediatric dentist?
A pediatric dentist is a dentist who has specialized in the care of children, very young children, adolescents, and children with special health care needs. So a dentist, pediatric dentistry, dentist focuses on both the primary and comprehensive care of that population.
Dental pain normally gets parents off guard, and in most cases they come to see a dentist after an overnight of dental pain. At what age should children be taken to see a dentist for the first time?
It is recommended that a child should be brought for their first dental checkup by their first birthday. But even better still, as soon as the first tooth erupts into the oral cavity.
Parents have questions and they wonder if they should start brushing their children's teeth when first teeth erupt, or if they should start brushing right away from birth, or if they should wait until the child begins school. What is the right age to start brushing a child's teeth?
Okay. So the essence of brushing is to make sure that the teeth in the mouth are kept clean, so that they do not develop cavities. So the right time to begin brushing is as soon as the first tooth erupts into the oral cavity. By erupting, I mean when the first tooth comes into the mouth. And normally it's around the age of 6 months. So then a parent should make arrangements to purchase a toothbrush and paste for the child. That withstanding, that does not mean that no brushing takes place between birth and 6 months. A mother is encouraged to be keeping the mouth clean as well by using a clean soft cloth that is soaked in warm water. So you take a clean soft cloth, soak it in warm water, and with your hands clean and water that has already boiled, that has cooled to room temperature, then you wipe the gums of the child. So cleaning of the mouth begins right after birth, but now we're using a soft cloth, but brushing now begins as soon as the first tooth comes into the mouth. That is the age of 6 months. Age of 6 months, yes.
You have mentioned that parents should start brushing their children's teeth after the first teeth erupt, maybe from the age of 6 months, or it varies. Do you mean children develop cavities?
Well, actually, by the time a child develops a cavity, a hole in the tooth, it is a chronic disease. That means you don't fail to clean your mouth today and you get a cavity tomorrow. No. It is a pile-up of overtime build-up of neglect of cleaning teeth that now results in a cavity. So you start brushing today at the age of 6 months to protect that tooth when the child will be 2 years, 3 years going forward. So it takes time for one to develop cavities, and that is why it is very important to ensure that brushing is a consistent habit. It should be part of a daily routine, daily, and most importantly, this brushing should be assisted. That means that a child who's 2 years, 3 years cannot brush adequately on their own because they have not developed what we call fine motor control. When you have a well-developed fine motor control, then you can be able to brush on your own. But until 6 years of age, we cannot adequately say that a child can brush well or effectively on their own. So mothers or caregivers need to play this crucial role of taking the interest and brushing for their children until the age of 6 years. Yes.
Thank you so much for that information. It is clear that most parents hand over the toothbrush to a child for them to just brush by themselves. So Thanks for that information that children need to be assisted when brushing. That means the parent should actually brush the child's tooth, whether mother, father, or an older sibling. Okay, and is there anything that parents can do to stop caries on their children's teeth?
Yes, a lot. So I say that children are under the care of their parents, and what actually happens in the child's mouth, parents really contribute a big role. One is by ensuring that they brush. So one of the biggest roles that parents can play in ensuring that children have good oral health is by brushing their children's teeth and introducing them into now making it a habit thereafter, 6 years, for them to brush on their own. So one way is facilitating to buy a toothbrush and toothpaste and ensuring that the children's teeth are kept clean. That is one. Number two, we know very well that these dental cavities are caused by sugars. And parents really play a big role in the choice of foods that children get to eat, whether at home or generally in their life. So parents can really play a big role to ensure that they provide alternative sugars, healthy sugar options to the children. Because we cannot say that sugar is entirely bad. We need sugar to get energy in our body, so we cannot completely cut out. But then what options are we giving for sugar? So we encourage fruits, apples, bananas, to be alternative options. So sugar cane, those are very good options as opposed to sweets, cakes, biscuits. Those are refined sugars that once they land on the teeth, now the bacteria in the mouth just start feasting on them. Then you have a lot of production of acid and then they destroy the tooth structure. So by providing alternative food sugar options, and whenever they provide sugar, you cannot really completely say children cannot eat sugars, to just try and control and ration. And that combined with good brushing, that is a very good role. Another thing that parents can do to ensure that children don't develop these cavities is by taking them for regular dental checkup, taking that responsibility and say, yes, it's a year gone by, it's time to go and visit the dentist. And from my experience, when we are coming to the dentist for a checkup, the outcomes are normally extremely fantastic because we're just coming, counting your teeth, checking how your teeth are okay. Do they look like they need some fluoride, to just boost the teeth? A bit of fluoride here, a bit of cleaning here and there. And if it is a cavity, most often than not, they are very minimal cavities. We can even do these fillings without local anesthesia. Local anesthesia, simply put, is the injection. Yeah. So regular visits provide better experiences, as opposed to a child who's being brought in because they didn't sleep last night. So they didn't sleep well, they are sleepy, they are cranky, they are tired, they are hungry because they have not eaten. So establishing that rapport and just dealing with the teeth provides a hurdle because they associate teeth with pain, and therefore this doctor is going to act on the tooth. So already there, the alarm bells for pain and wanting, fight and fright set in. Yeah.
How often do you see cavities in children in the Kenyan population?
Oh wow. Now, the latest survey by Kenya National Oral Health Survey 2015 showed that the prevalence of cavities among under 5s in Kenya is around 46%.
That's high.
So yeah, that is simply to say that for every 2 children you come across, you pick randomly, one is most likely to have a cavity.
For every 2 children coming, one has a cavity?
Yes.
I think that's a high number.
Yeah, precisely. It's going high. And when you look at trends in developing countries, the prevalence is much higher. So when I look at the population, that was 2015. Maybe if we can get more recent studies, chances are it's going to be higher. And based on my experience in where I work, we are now seeing children as young as 2 years, born 2018, 2017, 3 years, having very severe forms of early childhood caries. And when I talk about severe early childhood caries, I'm just saying that many teeth in their mouth are already dental cavities.
Would you say that these dental cavities are as a result of better livelihood that people are having right now, better economic status, where parents are able to afford foods with refined sugars, sweets, bread, and all that?
Yeah, precisely. That's a really big contributing factor. Yeah. Now, sugars, candy, biscuits are readily available.
Dr. In my practice, sometimes I meet children who are quite uncooperative and they cannot allow the dentist to clean their teeth or fix a cavity or even extract a tooth. Is it the end of the road for such children who have dental phobia or who really cannot allow a dentist to see them?
No, not at all. In fact, one of the biggest challenges we face in our practice is dealing with that uncooperative child. So it is a challenge that is known, it is common, because, well, it's expected, a child cannot rationalize and say, oh, you see, when I sit on this chair, the doctor will sort out the pain and I will feel better next time. They have no association of logic. So you just have to deal with that child as is. Within, a 2-year-old, 3-year-old, little communication can happen. A 7, 9-year-old, they can assess the benefits versus the risk analysis. You can negotiate.
Yes.
But some of these very young children we are seeing now, you cannot negotiate that. But thanks to medical technology, we have a lot of things that we can do. Now we can do general anesthesia, now having the patient, under anesthesia, like the medical surgical procedures. So now in a hospital setup, a patient is admitted and then we do what we call full mouth restorations. Yeah.
Then by full mouth restoration, do you mean fixing all the cavities that are there in the mouth, extracting teeth that need to be extracted and such?
Yes, precisely, because you will not want to take the child again under anesthesia. It is expensive, so you want to go in once, and if there are any teeth to extract, if there are any fillings to be done, if there are any crowns to be put, if there is anything called a space management you want to do everything in one visit. It has its pros and cons, because now, you see, with normal chairside procedures, then a child is able to develop that attitude and cope with dental, fear and dental procedures over their lifetime. But as opposed to general anesthesia, it means the child can still not face this situation. And so what if procedure fails, or what if they need another treatment? So that is the challenge, but at least there is hope that as the child grows, then now you can be able to do behavior management and let them be able to cope with dental procedures. That is one. Then we have what you call contrast sedation, where you just put a patient, you sedate them kind of, they are still awake and they can follow instructions, only that you're in control. So it requires machine, it is a bit capital intensive, but now I think in Eldoret soon we will have those services available. So to answer your question, it's not the end of the road for uncooperative children, and parents, be encouraged that it's not the end of the road. Don't give up, because the teeth of these children are very important. The reason why they are there is they need to be healthy. Those teeth need to be healthy and functional so that they can eat food, chew food for their nutrition. Then they can grow well. And also, who else doesn't want a beautiful smile, a child to have a good smile. So parents, be encouraged, if your child is one or such of a kind, explore options that are available within your vicinity so that your child can be taken care of.
Thank you so much, Dr. Zipporah Roth, for your time.
Yes, you're most welcome.
It is clear that children's teeth need attention as much as adult teeth. And we have learned today that we should start brushing our children's teeth as soon as they erupt. Maybe your child has teeth by the age of 6 months, or maybe as late as 2 years. It doesn't matter. Whether there are teeth in the mouth or not, it is important to keep a good oral hygiene. From 64 Dental Suits Eldoret, goodbye.